Today on the Honor Roll podcast, we'll be talking to our guests, Professor John Dormois and Aiden Jaskolka-Brown, about Aiden's life-changing decision to save a baby boy's life. Hey Honors Bulls! Welcome to the Honor Roll podcast, the flagship podcast of the Judy Genshaft Honors College Podcast Network. I'm Caroline Merriman, a third-year student studying English at USF, and I am joined today by my wonderful co-host Mridula Singh, who is a senior at USF who is studying biomedical sciences. How are you doing today, Mridula?
I'm doing well. The weather outside has been really nice, and I'm having a really good day today.
Yeah, I've definitely been enjoying the cooler weather. So every week, I like to start the podcast off with a big question, and today's big question is maybe going to be a surprising one, but did you know that if 0.01% of the population donated organs as living donors, that there wouldn't be a transplant list?
You know, that's so interesting because a lot of my research was actually in, organs, organ failure, and I never realized that there would be so many people that never consider being organ donors. So although no, I did not know that, I would hope that, at least 0.01% of our population would be interested.
Yeah, so seeing how much of a need there is for transplants, would you yourself ever consider being a living organ donor to save someone's life?
I definitely think if I was ever given the opportunity, even though it is a really hard decision to make, and we're going to see Aiden probably had a very hard time deciding, it is definitely something that is worth saving someone's life, especially when it's children. So,
yeah, I totally agree that, while it's something that could be really scary, when you see what good can come from it, I think it makes the decision worth it. And we're going to get to hear a lot about that and about that typical journey coming up shortly as we speak to Aiden Jaskolka-Brown, who is a USF student, and Professor Dr. John Dormois, and they're going to come and talk about Aiden's organ donation story, and that is coming up shortly. Are you interested in graduate study, prestigious scholarships, studying abroad? Serving all 3 USF campuses, the Office of National Scholars, ONS, mentors USF students for prestigious awards and scholarship programs focused on research, international education, graduate study, and intellectual development. If you're interested in applying for awards like Fulbright, Rhodes, or Marshall, don't wait. Meet with an ONS advisor to discover what's possible. You can visit the ONS website or drop by their office on the 2nd floor of the Judy Genshaft Honors College building to learn more. All right, hello everyone. Joining me now is Honors student Aiden Jaskolka-Brown and Honors affiliate faculty member Dr. John Dormois. Welcome, guys. Would you each like to introduce yourself a little bit more, let everybody get to know you a little bit?
Yeah, so my name is Aiden. I'm a junior biomedical sciences major, and I'm about to be a first-year medical student at the USF Health Morsani College of Medicine. A little bit about me. I'm from Colorado. I love skiing. I love playing competitive table tennis. I actually play for USF, and I'm just enjoying life right now.
Hi, I'm John Dormois. I'm a faculty member. I teach a class in applied ethics for primarily pre-med students. My background is a physician, as a cardiologist, later as a specialist in palliative care. So I enjoy lots of different things in life. I've had to give up a few things as I've gotten older, but I'm always open to new adventures.
All right, and so you're both here today to talk about your honors experience, and Dr. Dormois, your class that is Introduction to Medical Ethics, and also about some pretty extraordinary things. So Aiden, after a class discussion about organ transplantation, you actually took it upon yourself to investigate how to become a living donor. And last May, you donated a portion of your liver to a 5-month-old infant. Can you walk us through your story and tell us about what drove you to make such an incredible decision?
Yeah, so in the spring of my freshman year, I took biomedical ethics with Dr. Dormois, and we talked about many different ethical issues. So we talked about different issues such as abortion, we talked about end-of-life care, and we also talked about organ transplantation. And I learned so much from that class. I learned about how 96% of organ donors are dead and only 4% are living. And I was presented with a statistic that if 0.01% of the population donated organs as living donors, then there would not be a transplant list. And I felt that I had the capacity to make a difference in at least one of those people's lives. And so after a discussion with him about kidney transplantation, I figured I have some family issues in terms of kidney disease. And so another organ that you can donate is the liver. And the cool thing about the liver is that it regenerates.
How did you initiate the process?
So after doing a little bit of research, talking with Dr. Dormois, I brought it upon myself to sign up for a few organ transplantation living donor programs across the country. So a few of them include UF Health, Johns Hopkins University, and UC Health in my hometown of Denver. I signed up, and the quickest callback was in Denver, Colorado, from UC Health. And I got connected with an organ transplant coordinator, a donor coordinator, and they really laid out the whole process for me. And I ultimately decided this is something I want to continue. I first went through a lot of medical testing, a lot of blood panels, especially for my liver function. And they determined, okay, yeah, you're a good candidate. And then it was a long waiting process. I had to wait several months to finally get approved because I had also seen psychiatrists, I had seen social workers, a transplant surgeon, a hepatologist, all of these different people coming together and determining whether I'm a viable candidate. Not only do they have to determine that you're medically eligible, but that you have the psychological capacity to make such a life-altering decision. I mean, it's a voluntary surgery to be a living donor. And ultimately, I want to say in March or early April, they decided that I was a good candidate and that they would move forward with matching me.
What was it like to find out that you had been accepted and that there was going to be a recipient for your organ donation?
So in April, I got matched with a young adult woman, and I got very excited. I was told that I was going to have surgery on May 24th, so about a month later. But a few weeks after I got told I was matched, I was then told that she became medically ineligible. And the tough part about being an anonymous living donor is that you don't know anything about the background of the patients who you're giving a piece of yourself to. So I was told that she became medically ineligible, which could have meant a lot of things. It could have meant that she became too sick, unfortunately, to receive an organ, or she could have possibly found an organ sooner. But that is something I will never know because of HIPAA laws. So anyways, I was then in a waiting period again to get matched up. And during this time, I was actually taking the MCAT, so that was a little added stressor, but it all turned out okay. But anyways, on May 22nd, I got a call from my donor coordinator, and she told me there's this baby boy, he's very sick, and the surgeons do not want to wait until June to transplant his liver. So they asked me, are you able to come under the knife in 8 days? And I said, yeah, I mean, I planned my whole summer around this.
What was the process like from surgery to recovery? How did you handle all of that?
I went in for some final medical testing. They determined, yes, you're going under the knife. And 8 days later, I donated a left lateral segment of my liver to a baby. I woke up. I was very sore because they cut along this line called the linea alba, which essentially splits your abs into two. So I was very sore, and when I woke up, I was told by my mom that I was crying, asking, "How's the baby doing?" And I was a little high on morphine there, so
Aiden, how did this experience impact you?
I really felt satisfied after waking up, and my whole hospital stay of 4.5 days was absolutely wonderful. But at the same time, I still didn't know anything about my recipient, and so I waited weeks. I continued my recovery. It took about 6 to 8 weeks before I felt completely back to normal, which is relatively quick. They usually expect about 10 to 12 weeks. And so finally, they asked me if I wanted to send out a letter. My donor coordinator asked me if I wanted to send out a letter to the recipient's family, and so I did.
So when you reached out in a letter, what did you want to include in it to say to the recipient?
Yeah, so first I wanted to lightly introduce myself. I told them I'm a 20-year-old biomedical sciences major at the University of South Florida, but I also wanted to discuss my reasons for doing such an act of grandeur. And I thought they deserved an explanation that I wanted to save a life. I wanted to have that intimate feeling of quite literally giving a piece of myself to another person in order to save their life. And to that just feels absolutely satisfying and fulfilling in my life. Ultimately, I've determined that it's the relationships I have with other people that bring me joy in life and give my life meaning. And so what I was hoping in the letter is that they would return another letter and provide me contact information so that ultimately I could meet the family. And that's what ended up happening back in September. It was during my fall semester of my junior year. I got a letter in the mail, and it was one of the most adrenaline-rushing feelings to hear back from the family and hear how grateful they were, but also that their baby is doing good. I received some pictures too of the infant before and after their surgery, and the difference in how they looked was night and day. Before the surgery, they were looking very yellow. They had jaundice, all signs of liver failure. And afterwards, it's like a light was flipped on. They were smiling. They were absolutely happy. And their skin was not yellow, so that was most definitely a good thing to see. So ultimately, I waited until the end of my fall semester because it was very hectic to reach out again and see where they lived and if they would like to meet up. So after coordinating a little bit, I got to meet them, and this is very special, but I got to meet my liver recipient, Aiden, on his first birthday on December 27th. And when they first walked into the restaurant that we were meeting at, I saw that baby, and I just smiled. And they said, "Are you Aiden?" I said, "Yes." "Are you Sky?" And that's the mom's name. And we started hugging, we started chatting. I mean, it was one of the most human moments that I think any of us can really feel. To be able to see the products of your own donation, to see a baby that's thriving, and to see a family that's happy, that didn't have to deal with the tragedy of child loss. So we had dinner. We just talked about life, talked about our backgrounds. And a few days later, they had a party at their house. They kind of live in a farming sort of area, a little bit outside of the city of Denver. And I got to meet their extended family. I got to meet their great-grandma. I got to meet so many different people who were just so grateful for baby Kaiden to be alive and to be part of their family. And to be able to integrate myself with that family and hopefully for the rest of my life was truly magical. It really was.
So are you still in contact with the family?
Yes. So after that, they provided me contact information and we text. I tell them about how my life's going and they send me pictures of Kaiden doing new things. You know, he's a baby, so he's going through a lot of milestones. He's slightly delayed in development just because he's been in the hospital for so much of his life. But the other day, I got a text message that Kaiden went on his first ice fishing trip. And to be able to see just such a happy baby going out into the world, it was just wonderful. It really is.
Did you ever expect like that kind of relationship to kind of like flourish from your donation, like when you were going in? Did you see this kind of being an outcome?
So I was very hopeful that this would be an outcome. But again, because it's an anonymous donation, the recipient's family reserves the right, and I reserve the right too, not to have to contact the other side. And so there was a small chance that they would have never returned my letter, and that would have been it. And so I was hopeful, but at the same time, I knew that it was a possibility, and that was a risk I was willing to accept.
So, Dr. Dormois, you teach Introduction to Medical Ethics through case studies and Applied Medical Ethics course in the Honors College, where you, as previously mentioned, explore topics like experimentation on human subjects, access to care, abortion, and the right to die. So did Aiden get any extra credit for becoming a living organ donor?
Well, he gets extra credit from me personally, but remember, he did this well after he was in my class. Had he done this during class time, yes, I certainly would have given him extra credit.
Were you surprised to hear that he was pursuing organ donation all on his own? Is this something you typically see with students in your class, that they make a big decision like this?
Aiden is the first. It's a huge deal. Mm-hmm. It's to step up and say, I want to do this is quite unusual. And that's why we have so many people on the transplant waiting list, because other people don't step up and do something like Aiden has done. So I've not seen that before in a student. It's unusual. It's special, very special.
And would you be able to tell us a little bit more about your course and how you hope that it affects students and maybe changes their perspective on, the healthcare system and the ethics of it all? Well,
my students are all, shall we say, wannabe doctors. They're in that major. They hope to pursue that professionally. But these students are very naive about what medicine is really like, especially some of the more complicated ethical dilemmas that occur in medicine. And so my whole tactic is to expose them to controversial areas and help them be able to see the multiple sides that are involved in a complex issue like organ transplantation and how this impacts real living people. In the ethical part of it, I talk a lot about the black market that's used in organ transplantation so that students realize that how complicated it is, and it's not just a simple somebody like Aiden stepping up and wanting to donate, but a lot of people waiting that can't get an organ go to the black market. So students need to understand that how complex this whole process is, whether it's organ transplantation or access to medical care or brain death, all complex issues that are always filled with nuance. There's rarely ever a single, oh yes, this is the right answer unequivocally, but helping students see that there are multiple potential answers and how are they going to process issues like this when they have to face things.
Yeah, I would say that's really important in making our healthcare system more well-rounded and more interdisciplinary and inclusive for patients and for providers as well. Aiden, now having taken the course, did this change your perspective on your future career, or did it change your perspective on medicine and ethics as a whole, previous to what you've maybe learned in like your courses?
100%. I think this course was absolutely instrumental to my ability to be a good doctor. And I'd say to all students who would like to be a doctor, they need to take an ethics course, because when you're going into college and possibly even medical school, it often seems very black and white. Like, becoming a doctor means you like science and you like helping people. But in order to help people, you have to assess so many different ethical factors.
Want to live the Bulls life? Join the Judy Genshaft Honors College Living Learning Community. As a member of the Honors LLC, you enjoy special events like the Tapas Night Study Abroad Expo, service learning fairs, career prep workshops, LLC-only recreational travel, and more. The Honors LLC is available on all 3 University of South Florida campuses, but space is limited, so apply now. Visit the Judy Genshaft Honors College website to learn more.
One of the most key points was to assess issues in terms of 4 ethical pillars. You have autonomy, you have justice, beneficence, and non-maleficence. And these 4 factors are what you need to consider in terms of end-of-life care, abortion, all of these different issues that arise in the medical field. And so by taking this class, I really believe it shaped my ability to view patient care and systemic care, especially with the United States healthcare system and even abroad. It was absolutely instrumental to be able to view issues in a more complex and a more nuanced manner.
Mm-hmm. And did that help you view your experience with organ donation differently, and your experience, being treated in the hospital? Were you able to see those ideas play out?
Absolutely. So when we were talking about beneficence and non-maleficence, organ donation, you're obviously benefiting somebody else. Mm-hmm. So that contributes to the pillar of beneficence. But in terms of non-maleficence, you're also, by taking one person's organ and giving it to another person, you're also potentially harming somebody else who also needs an organ. And that ultimately brings up the question of who gets the organ. Mm-hmm. There are so many more people on the waiting list than there are available organs. And so the issue of determining who gets the organ, whether it's determined by age, how sick they are, it's a very complex issue that I really didn't realize until I had taken this class and until I had really gone through the process.
Mm-hmm. Now, Dr. Dormois, seeing how much Aiden has taken from this class and how it's inspired actual action in his life, what is it like getting to teach honor students like Aiden, and what is it like, over your course as an educator? How has it been getting to share your experiences with students and try and build a better future in healthcare, in our country?
Well, that's my goal, mm-hmm. is to educate them so that they have a greater understanding of what they really want to pursue, and hopefully equipping them with the realization that there are very complex issues that they're going to have to struggle with. Mm-hmm. And so I'd say the greatest feedback I get in a positive way is when I see my former students. I saw one yesterday at Tampa General who, I didn't recognize him. It had been 6 or 7 years since he was in my class, and stepping up and thanking me again for the experience and how it had benefited him. Those are the kinds of things that give me the kind of feedback about, yes, what I'm doing, what I'm trying to share is making an impact.
Yeah, exactly. And I think we can definitely see that through Aiden's experience and through other students' experiences as well. Now, would you guys encourage students to, consider being an organ donor, or is there any, I feel like there's a lot of fears about organ donation and about surgery because a lot of people don't know about it. Is there anything you can debunk about that or anything like that for our audience?
Well, I think what Aiden described about the beneficence of doing something that's going to benefit another. There is harm done to Aiden. Aiden had harm done because of the surgery, of the incision in his body and removing a section of his liver that he needs. And so in ethical situations, what I try to help students understand is there are these conflicts between these ethical pillars, conflict between benefit and harm. There's always harm in the background somewhere. And how do we juggle these? How do we offset and make a decision that the benefit so outweighs the harm that it's worth doing? And autonomy, he made an autonomous decision to donate a portion of his liver. So we talk about in class, are you an organ donor? Are you registered organ donor? So that in the unlikely event that you should be involved in some tragic event, that you've already stated that you want to do this. So to give the students something that's tangible for them here and now is what I think is really crucial.
So is there anything else that we haven't talked about so far that you guys would like to add on to? Anything about the class or about medical ethics in general, your story?
Yeah, I ultimately want to inspire other people to do similar gestures. Maybe not as big of a decision as undergoing surgery to donate an organ to somebody else. But even donating blood, donating platelets can really make a difference in people's lives. If you are interested in donating a kidney or part of your liver, you can most definitely talk with a donor coordinator, and they will lay out all of the risks, all of the benefits, and allow you to make an informed decision. The idea of an informed decision is absolutely crucial in ethics. And for me, I was able to lay out all of the risks, all of the benefits, and determine that it was something that I wanted to do. One of the issues with organ donation, however, is you're taking time off of work. And while the hospital pays for your surgery and your stay, you do have to forego lost wages. So for people who aren't as privileged to be in a situation where they have the capacity to step out of work for 2 to 3 months, it might not be the most ideal decision to donate a part of yourself.
Yeah.
But for people who are really looking to make a change in somebody's life and to directly benefit somebody else in a life-altering way, and not only the recipient, but their friends and family who don't have to watch them degenerate over time, if you have the capacity to make such a decision, I think you should.
And maybe for people who, have some fear around organ donation or blood donation, are there other ways that you think people can contribute to the same cause without, say there's other reasons that they're unable to donate blood or unable to donate an organ? Like, are there other ways to try and help support patients who do need like transplants and things like that?
Yeah, so there are several fundraisers throughout the country. About 6 weeks after my donation, I actually ran a 5K called the Donor Dash in downtown Denver, and it's a huge get-together with recipients' families, donors' families as well, for those tragic cases where, they had a family member who died but was able to save people's lives. And it's also a fundraiser. So providing funding for people who don't have the financial means of receiving and undergoing organ transplantation, initiatives like that make a huge difference. There's also the Transplant Games in Birmingham, Alabama. I think it's occurring in June or sometime around then. But once again, it's a big collection of people who really want to make a difference and spread awareness about the benefits of organ transplantation, both dead or live. And contributing to causes like that can, one, spread awareness, but also provide the financial means for people who face the unfortunate reality of the American healthcare system, where they can't afford, without going into tremendous debt, to have an organ transplant.
So, Dr. Dormois, does your class encourage students that, once they, reach their careers in the medical profession, whatever that may be, that they take their passion for healthcare beyond the hospital or beyond the clinic to actually lead initiatives in the community that serve to address maybe barriers to healthcare?
Well, absolutely. From very onset of the class, and whenever I have the opportunity, I remind these young people of the powerful voice that they have in the community, that if they're fortunate enough to become a physician, that I encourage them strongly to use their voice to speak out for issues of public health, directed at whatever, of anti-smoking campaigns or seatbelt campaigns or whatever it might be, that to remind students that physicians, because of all the years it takes to acquire a medical license and to get into practice, that they're respected in the community, and they need to use that voice to support things like organ transplantation, support unwed mothers, other social issues. And so even though I try to keep it apolitical if I can, some of those things are political. And I think it's important for the student to realize the power of their voice, and they need to lend that voice to things like organ transplantation.
And do you think like the field of medicine, the landscape of that field, do you think it's changing? Do you think it's allowing those changes to happen? Do you think it's following in suit with maybe, what your students are being taught and, the initiatives that they may be involving themselves in?
Well, I mean, what they're taught is, of course, a lot of science. There's a great deal of science that has to be attended to. But issues beyond that, the so-called social determinants of health that we talk a lot about now in medicine, the impact of living conditions and access to exercise and access to adequate food and nutrition. These are social issues, and that unfortunately tends to get political, and it's a complex arena in which to try to impact those things.
Absolutely. And how do you, I guess we've touched on this a lot, but how do you hope that students can use your class to navigate the gray space of medicine in that way of, you have to know your bounds as a physician, but also understand that many of the problems that you're dealing with have factors that are outside of your control?
Well, perhaps the most effective thing that I can do as a teacher at this stage of their development is to provide them personal stories of things that I have experienced and difficult decisions that I had to face and how I dealt with those. Stories are so powerful, and because of the feedback that students have given me, I know that they take away these stories as experiences that clearly influence them, and hopefully for the better.
Yeah. So many of our honor students are interested in the field of medicine, and the two of you offer distinct perspectives as an experienced MD and educator, and as a student who's already been accepted to USF's Morsani College of Medicine, and you're still in the start of your medical journey. So to wrap up, what advice would each of you share with students who are passionate about pursuing healthcare?
Personally, I think any medical student who is capable of learning the science should also learn about the ethics. Medicine isn't just black and white. It's a complex field. Mistakes are made, and that's actually one of the issues we talked about in that class, is how do you deal with medical mistakes? But being able to really assess a situation and provide care in a way that doesn't treat patients as machines to be fixed by pills, but rather as human beings, is one of the most important things that you can do as a physician. I'm sure we've all had experiences with a doctor we were slightly uncomfortable with or scared of, or we've had experiences with doctors who are our friends, essentially. And being able to distinguish yourself as one of those doctors who really makes a difference in people's lives, not just providing medication, but providing humanizing care, is truly what it means to be a physician.
Well, Aiden is certainly taking things that I've said to heart, but beyond the ethical pillars that he mentioned, which are really valuable, very helpful in terms of looking at ethical problem. One of the other things that I have come to focus on more and more are the virtues that occur in life and in medicine. And originally, when we first started talking about ethics, and Aristotle and Plato were 2,500 years ago or more, were talking about ethics, it was all about character. That's what ethics was about character. And so one of the things beyond the sort of ethical pillars that Aiden mentioned, the other thing that I really try to focus on is to remind them about those virtues that should be present, things like trustworthiness, honesty, integrity, empathy, and compassion. I push on those pretty hard because those character traits, if they're present, and the greater degree to which they are present, that physician is going to be more successful with his patients, because the patient will recognize this, as Aiden just said, as another human being rather than just a scientist that happens to be able to prescribe pills. So, yeah, I push those virtues very hard.
Yeah, that's really great to hear, and it gives me a lot of hope for our students and for the future of healthcare, that there are compassionate educators like you, and there are very passionate students like yourself, Aiden, who are wanting to bring more equity and more fairness and compassion to our healthcare system to improve patient and also provider lives. That is all the time we have today. I wanted to thank you both so much for taking your time to join us. It's been wonderful to hear about your experiences in the Honors College and your story about organ donation. And I'm sure that all of our students and everyone listening is going to be completely inspired by all of the work and the positivity that you guys have put out into our community and into the world. So yeah, thank you both for joining me today.
Absolutely. Thank you.
Certainly welcome.
Thank you, Caroline, for such an insightful interview. I feel like learning more about becoming a living organ donor. Speaking of inspiring honors students, we have our transfer and current USF student application deadline coming up March 25th, as well as the 3rd annual Climate Teach-In and Off the Wall Art Gallery April 1st to 5th.
That will do it for this week's episode. The Honor Roll podcast is recorded in the Judy Genshaft Honors College at the University of South Florida Tampa campus. Production assistance is provided by honors student Abby Malloy and Professor Adam Davidson. Thank you all so much for listening. Please do not forget to rate and review our podcast. We appreciate your feedback. Tune in next time for more honors stories.
Until next time, go Bulls!